This is Brenda Pavlik-McGowan. Welcome to my presentation of an analysis of technology in nursing administration. After a brief summary of the highlights of interviews conducted with an informatics nurse, a privacy officer, and a chief information officer at Strong Memorial Hospital, part of the University of Rochester Medical Center, Rochester, New York, I'll be outlining a broad overview of all of the technological and informatics systems and applications in place at the institution. I'll be describing the electronic health record system in place, as well as 4 other technological innovations currently in place that impact nursing delivery of care and patient outcome, ending with a summary and reflection. The informatics nurse interviewed was Mark Ott. He was truly a wealth of knowledge of the clinical and administrative applications currently being used at the University of Rochester Medical Center, including in inpatient and outpatient departments, the Golisano Children's Hospital, labs, and imaging. With his background as a nurse and an advanced degree in hospital administration, he's been working in his current position as an informatics nurse for the past year and a half. He sees his position as having 3 important focuses, his primary focus being the builds of Epic Impact, how they impact the workflow for the various areas of the medical center. He tries to ensure the technology in place supports clinical practice, but doesn't drive clinical practice, or in other words, the technology works for the end user and not vice versa. His second focus is the integration and the retrofitting of hardware into Epic, his third focus being the facilitation of communication for all users of informatics systems through communication strategies. His goal is for all users to be able to take full advantage of health literacy by ensuring that everyone is speaking the same language. The privacy officer interviewed Patricia Keynes, BSN, MSCDC, has been in her position for 10 years, overseeing Strong Memorial Hospital, University Health Services, and all outpatient clinics. She spoke about her position being out of vigilance, one of vigilance of the personal health information of the patients who are cared for at URMC. She deals with what she calls disgruntled patients and families when PHI has given out to the wrong person, and specifically finds that most common sources of breach of PHI happen with the release of the patient's after visit summary, or ABS, to the wrong patient. She interacts with nurses when nursing is involved in breach of privacy, encourages nurses to be conscious of where PHI is placed and the encryption of personal devices. She stressed that everyone needs to be aware and concerned about the ethical and moral impact of unprotected privacy and confidentiality. The Chief Information Officer of URMC interviewed was Thomas Barnett, MBA, does not have a medical background. He oversees the entire ISD department, which includes 500 employees, and considers his main focus to be that of keeping Epic systems, our electronic health record, up and running. When he took over his position, he found that his biggest challenge was modifying workflows, as that had not been done since the implementation of Epic, and the medical center was still operating on the original build. He considered any modification to the Epic system very carefully, though, because when he wants to utilize the tools that are offered by Epic as efficiently as possible, he's cautious that there is no healthcare event that does not have an IT response. He stated that his favorite saying is, "What you touch touches everything else," meaning that any modification made to the Epic system causes a ripple effect of unanticipated change and potential for negative impacts somewhere in the system. According to the CIO, there are currently 680 technological, clinical, and administrative applications being supported at the URMC. All applications are integrated to support every department. He used the term meta-technology to describe the use of healthcare software to supply the tools that care providers need to immediately access vital patient information in order to deliver care, quality patient safety. This type of software offers a secure, fully integrated system for computer providers, order entry, electronic health records, pharmacy management, electronic clinical documentation, integrated vital sign documentation, and medication reconciliation. While data is being aggregated for the medical center and we utilize data to drive care, according to the CIO, we have not yet begun to extract our data for research. However, there are plans for research involving genomic data in the near future. Epic Systems is a private healthcare EHR software company with software that can be used in a variety of clinical settings and is estimated to maintain EHR records for 190 million patients worldwide. 10 Things to Know About Epic 2017. They service mid-sized to large medical groups, hospitals, and integrated healthcare systems with clinical access and revenue functionality. Epic, EMR Strengths and Weaknesses, EHR Review 2018. Praised for its quick implementation and ease of use, Epic is also criticized by some for its lack of interoperability, costly setup, and challenging integration with clinical and billing software for other companies. Epic EMR Strengths and Weaknesses, EHR Review 2018. Epic was brought into URMC in 2011, functioning out of the box for a period of time until the current CIO came into position application, and it began to be customized from its original foundation build in order to improve workflow. The CIO, however, is a firm believer that too much customization of the original product leads to problems, and so stays with the firm 15% customized rule. Epic was first integrated into the inpatient units of Strong Memorial Hospital, but has since spread to the OR, ambulatory care, imaging, laboratory information system, and most recently patient scheduling through Cadence, one of the arms of the electronic patient access and review cycle, ePARC. The full ePARC launch is scheduled for the beginning of March 2018. Epic impacts nursing care through a streamlined approach to workflow for the provider, such as the nurse. It is a documentation tool that generates data useful in improving patient safety, evaluating care quality, maximizing efficiency, and measuring staffing needs. It can reduce and possibly prevent medical errors, which improves patient safety and outcomes. Epic EHR is also instrumental in assisting providers to better utilize data to meet federal policies regarding quality measures, Monica 2017. As discussed with the CIO, URMC feels that Epic is highly capable of interoperability through the Care Everywhere application in light of the fact that 374 other health systems use Epic, which is highly advantageous. Epic provides the raw data to measure outcomes and equip clinicians with the tools to analyze patient safety indicators in their own workflow and improve upon any necessary measures without manually abstracting the data, Monica 2017. While some users report issues with expense and lack of interoperability, the only disadvantages mentioned by the CIO was the potential for over-customizing, increasing the potential for something to go wrong within the system. The Epic EHR is attested for meaningful use according to federal data. In fact, Epic tends to be a top vendor of physicians and other healthcare professionals who earned Medicare incentive payments for using the technology, topping 486 other EHR developers, Con 2014. According to the CIO and PI, URMC has been fully reimbursed for Stage 1 and Stage 2 of meaningful use and is in line with merit-based incentive payment system, MIPS, and the Medicare Access and Chip Reauthorization Act, MACRA, which will begin in 2019. MU will be part of MIPS, which is part of MACRA, which changes the way that Medicare rewards providers, reimbursing based on value rather than volume. Golder, 2016. URMC is dedicated to staying current of CMS requirements and endeavors to stay on task with all governmental regulations as well as technological innovations by assembling groups of employees to stay ahead of and evaluate trends. According to the CIO, URMC uses role-based access control, which is a system of security whereby employees are granted certain levels of security according to their position within the hospital. This method of ensuring that only employees who have a reason to have access to certain types of information is popular within healthcare, as it protects institutions from fines from HIPAA audits, as well as from potential lawsuits by preventing access of patient data to the wrong personnel, WAISH 2013. The privacy officer explained that privacy and confidentiality of health records are maintained through the best and most up-to-date state-of-the-art security software systems, which is constantly monitored for breaches. She works closely with ISD and Public Safety and Information Security Officer, Health Information Management Director, and Human Resources for such occurrences as security breaches, computer theft, and social media breaches. When a breach of any kind is detected, she investigates the how and why of assembling all parties involved in the breach. She's involved in granting access to Epic for employees when needed and will interact with nurses if a breach in PHI has been detected. While the privacy officer feels that health care overall benefits from informatics and technology, the EHR has brought a whole new set of problems as more people are now more easily capable of accessing PHI in a broader scope. I'm now going to discuss 4 other technological innovations currently in place at URMC that impact nursing care, delivery of care, and patient outcomes. SMH began integrating the ASCOMP application of nurse presence into the nurse call-light system in 2016. This application involves nursing staff wearing locator badges that silence the call light when the nurse enters the room wearing a badge. The system also tracks and logs the movement of the caregiver throughout a specific unit via a centrally located computer, which can show the location of the nurse on the unit. This saves time in locating that nurse. It also tracks response time to call lights in an effort to improve upon patient experience and outcomes and improve patient safety. According to the informatics nurse, there are plans in the near future to also use the system to locate equipment quickly and efficiently. The usability of the system extends to the tracking of patients at risk for wandering, as well as call lights for nurses who are exposed to threatening situations in the workplace. Another technological innovation is the electronic scheduling program being used at URMC. It is known as Medical Scheduling System, MSS, and is a homegrown system created by one of SMH's respiratory therapists in the mid-2000s in response to the need to move from an inefficient paper staff Scheduling system. Used initially for the respiratory care department, the program was soon launched to support the self-scheduling of hourly staff on all inpatients in the hospital. Its capabilities include productive and non-productive time codes, extra shift requests, tracking of absences, and changes made to schedules. For about 6 years, it was also used to track staff education records and annual performance evaluations for RNs. It has facilitated the ability to patient care units to better and more consistently staff their areas while being able to examine staffing mix, leading to increased staff satisfaction and retention, and ultimately better patient care. The automated dispensing cabinet known as Pyxis has been used by URMC since the 1990s. Medications are stored in and dispensed by the Pyxis unit similar to a vending machine with sophisticated software and can process patient orders, medication dosing documentation, inventory operations, and perform billing transactions. Newman, 2016. Over the years, Pyxis has introduced new generations of their product, and URMC has upgraded the software to stay current of new technology and also to integrate with the Epic system. This device allows the nurse to see up-to-date medication orders at any time, linking orders to eliminate repeated dosaging, checks for medication allergies, issues a warning if doses of the same drug are too close together, all of which improves workflow. Medication errors are dramatically reduced, leading to better patient outcomes, and workflow is improved. The Nova StatStrip glucose meter was brought up into use by URMC in 2015. Due to high incidence of adverse patient events and deaths, the need for an advanced and accurate meter was recognized. The StatStrip has been cleared by the FDA as being so accurate in measuring blood glucose levels that it can be used for point-of-care testing in hospital for all patients, including those with complex medical conditions found in intensive care units. This meter eliminates interference with medications, improves accuracy of testing, thereby decreasing incidence of insulin misdoses, and improving outcomes for patients. Novab, BO 2018. It maintains wireless meter connectivity to the laboratory information system and is integrated into the Epic EHR. In addition to improving patient safety and outcomes, the StatStrip meter improves nursing workflow by allowing nurses to quickly see downloadable blood glucose results in the medication administration record in order to obtain accurate insulin dosing. It's been shown that the later stages of electronic health record adoption show great potential for improving patient outcomes through such measures as decreased length of stay and decreased rates of hospital readmission. Hessel et al. 2015. This use of advanced technology, as it is integrated into practice, has been shown to be strongly linked to improved nursing work environments and better quality nursing care, leading to increased patient satisfaction. Hessel et al. 2015. It is clear that healthcare is being transformed by many forces, including financial and governmental influence, patient demands, and the addition of technology. We are in the midst of a period of the generation of untapped knowledge and relationships that all impact health organizations, care providers, and patients. From this analysis of technological overview from my institution, I was very impressed by the following 4 points. The sheer enormity of technological advances that are around me that have been so finely integrated. The user drives the technology, not the other way around. Informatics and technology has increased the need for security of PHI due to increased access. The consumerization of healthcare. Patients are demanding higher quality pricing and more a transparent, simplified billing process and greater customer satisfaction. J.P. Morgan Chase, 2018. My final reflection: even though I've been in the midst of a technological revolution and have indeed felt the pull of it, I had no idea how vast and deep this revolution goes. This experience has truly opened my eyes to what is currently happening to me personally as well as professionally with regard to technological advances in healthcare. It's made me sit up and take notes and not brush aside that upgrade that we're about to experience in Epic. I want to embrace the change and incorporate it into my practice on a more conscious and intentional level. The possibilities of improving healthcare and patient outcomes is within my reach. I can see that nurse administrators are on the forefront of this change. Just as my coworkers are in the middle of their evolution of healthcare, they are busy doing the work of nursing, taking care of their patients. Nurse administrators who are informed and proficient in the field of health informatics will be the force that reminds the bedside nurse that technology is rapidly advancing and we must all ride this wave together in order to provide safe, quality patient care. Please note the list of references. Thank you for listening.